Daktari Akwikwan. Unajua kuna wase fulani wametutusi ati madaktari jo tunajua tu medicine ati hatujui mambo zingine. There's somebody who actually said on X, and X is usually a very toxic place. Alisema ya kwamba madaktari ati wasiongelele siasa, hamjui politics, you stay away, siasa tuachie other people. Today we are here to prove you wrong. Today we are doing a fully political show, and that's why I like Daktari Akwikwan. And this is bragging. Like the politicians we're about to have today, we have range. So we've had the waiter guy, we've had business people, we've had leaders, we've had, nutrition people. Today we have a politician, a fully fledged one. Na leo tunapiga tu siasa from A to Z. Siasa ya nchi, siasa ya sijui kina nani, everything. Even ya KMPDU iko pale ndani. Plus we'll talk about these more things and how it goes and the future for medicine and what is your role as a medic or as whoever you are in shaping the future for this country. So stay tuned. Furaya leo tuko na Boniface Oduory, daktari mwenyewe. Jamaa hatari sana. Kwanza alinibia kura tukiwa med school. Lakini that's a story that we'll discuss in there. So stay tuned. Furaya. Kama kawaida piga like yako, subscribe, comment, share and tell a friend to tell a friend. Daktari Akwikwan. Furaya. Daktari Akwikwan, show ya leo kama vile nimewashow ni very interesting. Sababu niko na one of my former classmates, alumnus were one of the best unis in the country.
For sure.
When it comes to providing or educating doctors. Na jamani, mnaona ile suti amevaa. Si kama zile za Gachagua. Suti imekubali kukubali. This is Dr. Boniface Oduory.
Yes.
Boni. For a long time man. Karibu.
Kofiti sana. Hadi mimi hata kuita doc yani nimezoea festo. Shanga sasa doctor.
Hata mimi nashanga wewe ni Boni.
Bana juu sasa
Bona.
Haso tumepiga pamoja.
Maze. Kwanza unajua hata siku hizi naenda kupigia wasee napata bado imewasave na zile majina za hata kuongeza doctor
mimi sijai mbele ya hata jina lako sijai change. Ukinipigia saa itaandika festo med.
ile ya first year sijui
bro ya first year ile ya meet up point hi your festo amboni sawa festo med boni med tuendelee.
Mimi nilikuwa na change tukiongea na mse after graduation naongeza hapo med doctor.
It's the same. Yeah.
So unasema these titles don't matter. Unajua jinsi tulikuwa na hiyo ya titles.
Yes. There's nothing in a title, but it's a title. Like you are a doctor. Si festo hata uende wapi saa hata ufanye nini, you are a doctor.
It doesn't change. Whether or not somebody calls
whether you need a doctor so and so it's already I'm a doctor. So sioni
historia nini, historia titles ilikuwa inaleta pressure sana pale kwa our brothers the CEOs.
Bro, lakini unajua nashangaa mbona uende koti kufuatia tuito daktari like what like nini ina happen next sielewi bro. You see there are only two ways. Either you go to school that is for tulikuwa tunaita penguins. Nakumbuka kitambo tulikuwa penguins but sorry for another day. But for non-medics, if you want to be a doctor, you know what you need to do for you to become a doctor.
Yeah. Go to school.
Go to medical school. If you want to become a medical doctor, you go to a medical school. If you want to become a philosophical doctor,
you go to school now
properly uwe doctor of philosophy and blah blah. But you see kama wewe umeenda shule yako yenye inafaa ikuwe ni that is the title. It doesn't change. Like why should you fight call me doctor and chakuita daktari what else?
I love because even somebody was saying either way when for example these clinical officers when patients go to the hospital kwani wanaitangaje
exactly unaitwa daktari daktari ndio wanafurahia kuitwa madaktari more than even us.
So
but it's honestly me I think it's about the scope of work, what you can do. It doesn't matter whether you're called professor or who. It's about the scope, what can you offer exactly on the ground. Nikikuita daktari lakini operation ikuja uwezi fanya, am I helping? I change exactly. But the fact that nakuita doc has it changed anything?
Not
So it's about
really.
semantics. For that, yeah, we can even call them for free without going to court.
They don't have to go to
They don't
court.
have to go to court.
Tumewapea.
Tumewapea. Hata wanaitwa already.
No,
So
not already. So it's not. Yeah, I think sometimes these guys can be.
Yeah.
It's a pettiness. But it's an ego
But
game.
ni war, yeah.
Come
ni
on, they
war.
want it. Let them go for it.
It's true. It's true. It's true.
I'm one of those people who, and this attracts a lot of attack from the clinical officer communities and even other people, the stakeholders. I'm one of those people who believe that, we have now medical schools that can train, doctors
It's true.
effectively. Why should we have a cadre that of patients who are seen by these people who are trained this way and these who are trained this way? Why don't we just make it uniform?
You see, my brother, I think it's walikuwa naitanga tukikuwa shule ngata poor man's medicine. Poor man's medicine. Because now in Kenya it depends on what you have. It depends what you will access. Those who have it access the best. Umayona MP akiwa mgonjwa akipelekwa Mbagathi Mama Lucy.
Mimi hata sijui anaendanga wapi mzee.
Ako wapi akiwa mgonjwa? Unasinga tu kwa NH ama ameingia kare, ameingia wapi, like place
big,
place penye most likely chances are ukipata CEO maybe ni ule specialized CEO.
Ama I've seen where CEOs work as wale watu wa insurance, but they're called care team.
Yeah.
So they don't interact with you
Care managers in these insurances. Yeah, it's true.
They don't interact with you as a patient, as your doctor. They don't treat you.
Yes, in those facilities. But you see now, so kusema place kama home, mumeingia village, bro. What do you expect to see in the village? Whom do you expect to see?
A clinical officer.
Clinical officer, nurse.
Yeah.
Rarely will you find those health centers ukiwa na NMO. Emo utaanza kumwonea huko kwa district
hospital.
You get.
Yeah,
so is this about, you see, the evolution ilikuwa imekuja kucure such things, but unfortunately hata ndo zimekuwa worse.
Yeah, because you're finding a whole county 10 doctors.
Exactly. Unasikia
ati inclusive of specialists.
At the county wants to advertise, they want only 5 MOs. You want like 5 MOs. Mnataka
what are they going to do?
Mnawapeleka wapi? You have 6 sub counties. Unataka 5. Why mnawapeleka aje? So I think it's just about how our system is.
But now shida we have enough now. I mean, if all doctors were to be employed, well, it wouldn't cover the shortage. It wouldn't cover, but I think.
But we will be there. We will be somewhere. We will be somewhere. Yes, we'll be somewhere. Because actually, the number of our colleagues who are outside, it's quite.
It's a lot, yeah.
Most people are just coming in private facilities.
True.
The absorption haiko. We advert ya mwisho face uliona ni ali.
Ya county maze.
Ya mwisho uliona ya county ati advertise nitaka wase.
Yes, imekawia by the.
Alafu wakiadvertise maybe ni kama wase 20. We need like 20 MOs. Bro, 20 MOs hata hiyo county pekee. In fact, let me give you a story. Najua stories za county zinaweza kupiga pressure ukufa.
Hebu tupe story. Walikufanyaje?
You see, like let me take for example my county, Busia County. Busia walitoa advert in 2022 ama 2023. There about.
That's after the election.
Yes. Governor shaingia. Then 2023 akatoa advert. Watu wakakaa paka 2024 ndio interviews zinafanywa.
A whole year.
As we speak right now, watu wajaijua results za interviews zilienda aje, if there was any recruitment that was done.
They were never hired.
This I'm telling you, when it comes to county government, the idea was fine.
The idea is still fine.
The idea is, yani, at least they wanted things to go mashinani.
Yeah.
Kila mtu akuwe na equal distribution of resources. Kama tunataka specialist tano in this facility wakuwe kama this county.
It was Raila's dream.
Exactly. But unfortunately, I don't think if that dream has been actualized.
It hasn't. So. Because even now, we are discussing whether devolution is working. It's almost more than 10 years since.
More than 10 years.
Yeah.
It's more than 10 years.
It's 15.
From the 2010 constitution.
15, that's 15.
Yes.
But then the first election was in 2012.
In 2012, yeah. So around 13 years.
Yeah. That's a lot of years.
Those are 2 election cycles.
Those are 2 elections.
Yes. So tunafasa yetu kuwa na already unajua kulikuwa na example enye wanataka kukopi how it works. I'm wondering kwani benchmarking ilikuwa
No, I think we always in Kenya we always come back to the same thing. It's corruption.
It's true.
We all want to eat. We all want to eat, and it negates the progress
Kila
that
mtu
we
anasema
have
it's
made.
my time.
It's my
It's
time
my
to eat.
time.
Anyway, that is it. That is Kenya. So, Daktari, we were talking about the title
The
doctor.
title doctor. But by the lakini, do you remember we had a few of our colleagues who had come to, they were practicing clinicians for quite a long time. Na wakakuja kuingia med school. And then eventually we graduated together as doctors. You get? So, like hiyo njia already iko hapo. It's a njia iko. So you can't reinvent the wheel. Already njia iko hapo. First, if you need to be a doctor, this is what you need to do.
This is what you need to do.
Exactly. So it's, I don't think there's anything to discuss about it.
Anyway,
I think
you now talking about the njia.
Yeah, exactly.
Wewe tuambie hii njia yako ilikuwaje? Wewe ulifikaje hapa? Wewe ulifikaje hapa daktari? Because doc, one thing I've noticed doing this podcast, because I talk to guys and I always ask this question. Did you always want to be a doctor? And most people are like, I know. Kwanza most people actually, our generation and even older, they're like, Mimi, I found myself here. Wait, did you?
Yeah, I think ni brilliance inafanya inakupea opportunity. True. You see now, when primary mimi nilipigia tu shughuli yangu pale village.
Kwani wale wa vile
uko Budalangi piga shughuli yangu.
Budalangi.
Mafuriko kidogo hapo na pale.
Acha ufale.
Mnafunga shule kidogo, mko camp.
Mnabebwa,
mko camp.
Camp.
Wallahi like because our school now used to act as a camp. Hizo zingine zikiswipiwa, so was kidogo place rest.
So everybody comes from the villages to the school.
So there'll be no learning definitely. Si mshafunga za shule.
Mlikuwa mnaenjoy. Unajua sila watoi
bro, that we did it as a disaster.
Yeah, mnaenjoy ati mko break.
You're like tuko holiday free bana. Vitu ziko
so Budalangi.
Yeah, sure.
Uko kwa ule jamaa
so, Wanjala ama Ababu.
Suddenly so clever.
Yeah. Yeah. So hapo tukapiga shughuli. Toka hapo
primary ilikuwa inaitwa
Mundikabi primary.
Mundika.
Hey bro, it's
polling station proper.
It's to date the polling station. To date. But tukapiga shughuli. Tukaingia pale St Mary's Kibabi. Side National School by the way for your information.
We are sorry. Kibabi has become a national school.
Yeah, I think tourism of the STEM nini blah blah. But okay. Yeah, tukapiga shughuli hiyo time ilikuwa extra provincial. Tukapiga shughuli pale Kibabi.
So ulikuwa ushatesa pale Shatero
kwa tu
despite the floods.
Of course. Yani huko sasa kijiji unajua so kitoka uingia high school nini pia tunaingia pale Kibabi Bungoma tunapiga shughuli. Pata air yako safi,
clean
clean. Alafu unaingia sasa
unaingia med school.
Unaingia Maseno sasa.
Uliamwaje Maseno?
No actually. So, me once results zilitoka. Unajua umesema ulitaka kuwa daktari. Once results zilitoka. You see,
kushaona ni
career guidance pia ni muhimu sana. Sometimes we lack career guidance. Like for me,
our generation we totally lack.
Mimi naye nilikuwa nishasema naenda UON. I just wanted UON. Niingie pharmacy. I wanted to do pharmacy. Became used to intrigue me so much.
Did you know what it entailed, pharmacy ama ulikuwa unasema?
Mimi nimesikia tu madawa na
yeah, madawa ndio mzuri.
Sikia tu madawa sasa madawa maybe ndio inabamba acha. Tunde ya madawa. Kidogo sana ndio my uncle akanita akaniambia hapana, now this is going to do. Akaanalyze akaona okay hizi your fit here well without struggle. So choose medicine first, pharmacy second, then engineering nini. So that's what I did. And then selection kakuja I was just straight called to Maseno. Na sasa hapo ndo jani ikaanza ndugu yangu.
Ukaanza hii jani.
MBCHB. Jani of being an MBCHB holder is not easy with IT. It's not easy. I don't think it will ever be easy.
It's not easy. That's why
it builds resilience. It needs resilience. Nataka like you must give up a lot of things. Because for sure doc najua sisi we start life maybe at around 26, 27 years.
Yeah, and we were talking about it juicy. I was even discussing it on my TikTok. You know, I had a patient, Juicy. She was my patient, corporate patient. So she's come. She's like 33, going to 30. I think 34, 35 then. And you know, this mama looks very confident. Mercedes yake baridi. And then when we were talking stories, she's like, Mimi hata I've worked too much, daktari. I need to retire. I'm like, you're
33. What do you mean?
What do you mean? But she's like, daktari, you know, I've been working since I was 22.
Look at that. Already 11 years of experience.
Exactly. And that's like my age, mate.
It's true.
Yeah.
And we're barely 5-6 years in the profession. It's true. So, it's sisi by the time tunatoka kama it's because 6 years, then 1 year of internship.
It's a long time.
But that's 7 years, give and take.
And it's a trimester.
Yes. So ingine ni mbili. Mwingine hata akienda mahali penye ata combine all through.
Yeah, watu upiga hivyo.
In 3 years ashamaliza ma 2.5 years ashamaliza degree, ameanza job. Wewe hiyo time uko third year ba.
Mazee wase walikuwa na graduate sisi hata
haujaruka hata clinic hii, haujaruka
wase your age mates are already going. So it eats up a lot of our time.
Yeah, it is a lot of time. It needs a lot of resilience. There are all things that we're going to give up. But in the end, end.
What did you give up?
Bro.
You give up umesema sana.
Yeah. You need to. Because you need to. Because you see, sometimes Cheryl kuna shika. Cheryl kuna shika. So lazima pia you have to. Because nayo, ikishika sana, the other side pia inakuwa tricky.
Yeah, true.
Kumbuka hii yetu bro, haina any other thing. It's either yes or no.
It's yes or no.
Yes or no.
And Josie, I was talking to actually the last episode we did was with Dr. Bani Nanga. This guy is big. I don't know if you watched it. They're way down. Huge. And he was actually Kenya's strongest man at some point in the official competition. Unajua zile za wasee kupiga kurusha mavitu kuinua mataya. And this guy is a doctor. And just doing this shughuli akiwa med school. Guess what happened?
Ali
Rosafi. Akose.
Rosafi.
Ndio hata niko na mshow mazata si huko Maseno kuna mashughuli tulikuwa tunaingilia na zikatu
shughuli ukiingilia lazima ujue med school nayo by the way it's I don't know, it's among med school is kama ile vitu zinazo old school, old fashioned. They need a route. This is the route. Either following this route ama hakuna ati utatembea hapa na unaweza tembea hapa. Ukiamua kutembea hivi hii nyingine inakuacha.
Njia mbili huwezi.
Njia mbili
huwezi ni ngumu.
You need to choose. You must choose. So you must make a decision at some point. Sema tufanyaje.
I remember when you were president. You were president when I was a hall rep, right?
Yeah, I remember. Yes. You were in Congress when I was a president. Yes.
So when you were president, I was in third year. Was I in third year? Yes. And this time, it happened that there was a trip the SOMO, the students organizer, had organized to go to Moi University.
Yes.
And that day, ilikuwa tunaenda the next, I think it was on Friday, we were going to Moi. And then that same Friday, we had a CAT result that was released by pathology. Dr. Juliet Tabali. Mbaya alikuwa ametoa CAT.
Gentleman that one.
Nilikuwa nimeuma sijui 26. Nilikuwa nimeuma 26 doc.
Ilikuwa pita sana.
Nilikuwa nimeshinda wase kadhaa
pathology bro.
Nilikuwa nimeshinda wase kadhaa. But unajua hapo nilipiga darubini yangu. Nikaangalia
hapa ni kutriki
next few months. Ndiye inakuja.
Nikiendelea hivi ukajiita mkutano.
Nilijita mkutano. Nikasema kitu ya kwanza bro. Trip wendi. By the way, I disciplined myself. Nikajambia okay, sawa.
Ukabaki.
You already won the election. Sawa. So unakula salary.
That's enough.
Nikachukua 50 bob yangu nikaenda nikanunua kitabu kwa canteen pale nje ikiwani.
Exercise book. Let's start this thing.
Uzuri
nayo. The good thing with it, I don't know, but you see Festo, tuseme tu, sometime when you are young, things tend to play along with the mind, danganya hapa na pale, but medicine is such a way that ukiamua po ukae tu ati unaisoma, unaipita sana unapata unaipita sana so, na usipoisoma pia itakulemea sana yani haina two way there's no two way about it so it's either you following the script you reading na unapita ama hausomi na mambo ni kangaja so I remember me and you in politics by the way we started politics
very early.
Kama mimi hata bro mimi niliingia kama nimeanza siasa. Me I came in the first year I ran I think with Dr. Moroga.
Yes. That was for
was for treasurer wa Msomsa yes our student organization sasa when we were founding it then now became the treasurer for a year then the next year now I ran for Congress as representatives of School of Medicine.
Do you remember who you rigged the election?
I ran against you, my brother.
Do you remember rigging?
I didn't rig it. I stand by that.
That election was stolen.
First of all, I didn't steal anything. Honestly, I've never stolen an election. I don't know. I don't know how to steal, but me sijaiba. You're a whole rep. I don't know. I just hate people. And actually, it's from the other class that gave me a lot of people.
Our class.
Yes. Ndio alinipea watu wengi. Ndio alinipea kura. Wacha tusingie kwa nitty-gritty. Yes. But after that, then that was now in second year. In third year, then I ran. Same year when I was School of Medicine representative. I remember in those time hiyo kura za kina Makosi ilikuwa na shida. So at that point again I became the speaker of the
you became the speaker of that Congress.
Of that Congress.
Thanks to me letting you win. Letting you read rather.
After that then we worked for a year, then now I ran for president.
While you and I in third year.
Yes, in third year now. So I ran for president, I won
and you said antidote.
Yes, the antidote.
And I joined you, by the way.
The hope, the change, the antidote.
The antidote.
That slogan, bro. Nyamwea kudos, jo.
Nyamwea alichora slogan.
Nguvu sana. Yeah. Alichora, bana bro, me I had strategists. I was just running an election. I had a team. You saw how we were presenting ourselves.
Yeah.
We had a team. We were planning our campaigns. We had professionals also, of course, from support from our politicians back at home.
And you see that was campus politics. It was
that
good.
Was campus politics.
It was good.
Yeah.
Until Ndwale came up with some bill.
Yes, sorry, sijui ati sayo wanavotiwa na nini. The called delegates.
Yeah. And you know, the reason I really fully disagree with that modus of operation, because you've talked about the Makoti time. And you remember those time we were following the national whatever.
Yes.
And people were voting the way nationals
the pattern,
go.
Yes.
The pattern is the same.
The coalitions.
So, yeah, I think, it's in university where I'm holding leaders. So I always think that whatever is going on in university should reflect the national, the way it's in the national. So it's, if we're doing presidential system here, why are we doing
a parliamentary system here? It's true. Because actually what they are doing right now is parliamentary.
Yes, and that's not what's happening on the national.
The national, it's true.
So,
but now it's right now I think it's just about money now. If you can mobilize resources, you get
because you can bribe those people.
Just get the delegates and then take them to do whatever you need to do.
Mlikuwa mnawapeleka wapi?
Lakini mimi siko na delegates. Sisi tulikuwa na remember Kamkunji. The people Kamkunji tulikuwa tunafanya bana. The Kamkunji.
Those were nice.
Those were real campaigns, bro. Yani
we used to call them solos. You remember those?
Yes.
Remember those big tracks?
Our tracks.
No, after Prague.
The gang.
It was real campaign.
It was nice. It was really nice. I don't think there's any door I have never knocked in Maseno. Bro, and that's how determined I was. I knocked on every single door in Maseno when I wanted to be president. Personally,
yes. You shook every hand.
Cha. Hi, how are you? Hi, how are you? Hi, how are you? I am so. Adi inakuwa, hey.
How was that experience like that?
It was good, It was good, bro. I think it's something that I think in the future I'll pursue. God willing, for sure.
You loved it. Endorphins were raised.
Yeah, they were raised. There's something with leadership. And if if you've ever been a leader, kuna vile tu yani you fail, there's something you can do different. Kuna kitu intrinsic inakusukuma kufanya something.
Yes, go for it.
Yes, so it's in the offing, but for now we tone down.
Bana wewe, when we were leaving med school, mimi I was sure bana 2022 Boniface Oduory Budalangi, is it Budalangi East or North?
No, Budalangi is just Budalangi.
Is this Budalangi?
Yeah.
Nilikuwa nafikiria unasema daktari na kazi.
No. I think I think I saw my good friend Wambura go for it.
Wambura went for MCA.
Yeah, it's a good start.
Jenjao went for MCA.
Yes. Yeah. It's a good start. So it means people are Abok I think is going for Kasipul. Yeah.
MP or MCA?
MP. See, right now Kasipul kuna
vacancy.
Yes.
The by-election.
For Ngondo yes.
Kichina sijasikia amedeclare wapi?
Yeah. So in our alumni group alituambia, but he's still working on it.
Oh, in the Maseno powerhouse.
Yes.
So was he follow sana chats.
I think nini wale watu wa viewers unakuja wazi scroll kila kitu unarudisha chini alafu unaacha au fuatilia conversation, but I think doc it's something that we plus all these things we started with on the show, our healthcare, how can it improve. Personally, I think if we are at the table of the decision makers, we'll be able to make good decisions for our profession.
True.
Because our profession is lacking, because sometimes we lack representation. How many medical doctors are in the parliament?
Is it just two? One is in the parliament, the other is in the Senate.
Exactly.
Nikal and
but who chair health committee is a doctor. He's a surgeon. Who is this? See who ni Bukose ama ndonga nani? This guy or health committee.
I thought it was what they gave it to Nyikal.
Oshana Nyikal yule mwenye alikuwa before.
He's a surgeon.
There's a guy who was there and
imagine Sinji.
It was frustrating us very bad. And he only turned out that he was a surgeon.
Allah.
He's a GS. I was like, okay.
Now see that
who?
You see now that becomes the problem.
Yeah.
Because even there was a time Uhuru Kenyatta, when Uhuru came, he had this slogan that he's not going to have politicians in this cabinet.
Yes. Technocrats.
Yes.
Manning
Professionals and things like that. And he gave 2 doctors to the ministry. You remember Mailu and who was this other guy? We were singing. It was Mailu and somebody else. I forget the name.
At the Ministry of Health?
As the Mailu was the CS, and then there was a PS. Karungari or something. I remember, I forget the name. But the guys were terrible, man. The guys were terrible. I mean, they had to be out.
I don't know.
The other guys, I think Kinaoluga were arrested during that time.
During that time?
Yeah. And they are doctors. So when you're telling me a general surgeon was at the health committee before.
Ebu just check, doc. I don't know.
We'll check.
We'll check. But there's a GS here who was the chair by that time. During kwanza hii time ya internship. Hii time tulikuwa tunangangania interns wa post as per the CBA. Yes. Someone who was there was at the helm was
as a general surgeon.
A GS. Like I was a doctor, medical doctor, and we went to him.
That's disappointing, man. That's disappointing.
So that's why sometimes I think we just need to get enough representation.
We do.
That once you have your own people there, they can advance your interest. They are the ones who know what training a medical doctor does. Like ninini, what do you want? What do you need for you to train a doctor?
True.
So that tukisema interns alipo as per the CBA, what do interns do?
Exactly.
Mimi nishafanya internship. I know what interns
do.
So you can't be there. Yeah. You see, we have people at the ministry wenye anataka officer kuja amueleze, by the way, intern ufanya ABCD. Like you're justifying a reason to why umlipe unafaa kumlipe. But if I went there, I did the same thing. I know I don't need to explain to me. I know what interns do. And I think maybe having Oluga there, you see, nimeona imewekwa kwa budget already.
Yeah, vitu zinasonga
kidogo.
Yeah,
so it's, I think sometimes you just need your person to be there.
True. Na sijui, I think we need to encourage doctors to run for these elective posts.
It's true.
Because
we should.
I usually, I'm not sure about this. These are allegations. But I think about how Nahumicha got to that spot. And it's because Papa Waroma was asked to give someone to health Nyako. And he looked around and no doctor had run for any post under Ford Kenya.
Na hakukuwa na mtu yote any doctor in Ford Kenya.
No one. So
akasema
anything close,
the nearest doctor,
anybody with anything close, mimi nilifanya online,
that goes with it, kuja chukua
online power. And that's how easy it would have been for any doctor to be at that helm.
It's true. Ni vile tu sometime madaktari pia festo bila umeona once umeingia kwa profession you tend to go deeper in the profession, like now your things ziko narrowed to medicine, so most of them wako into this
it's
politics.
Hard to diversify. It's hard to
wanasema tu mimi nisha train bana, nishakuwa this and this, so this is my line. Let me just run on
and
my
already
line.
you're a bit late in life.
Yeah.
You're chasing family, you're chasing other things, you're still trying to be financially stable. So ukifikiria tena mazee
na uingize hapa something side
milioni sijui ngapi hapo,
inakuwa tricky.
What do you think we can do about that, doctor?
No, I think for some of us who have interest in it, we should just pursue it. Earliest time possible. Why not?
So umesema 2027?
No, I can't run in 2027.
Daktari declare.
I can't run in 2027.
Mtu declare alafu ana back out.
Hiyo sasa nilikataa. Hiyo ndo nilisema.
Ulisema mimi declare unaenda.
Sitaifanya. First I'll never tell you that I'll run in 2027. Then I fail to run. Niambia ati hapana, siko ready, hapana. The time nitasema I'm going to run, I'll be ready. Like I'll be ready.
And you're going for it.
I'm going for it. Sitaki kubahatisha. Because you see, at home nimeona, you see, when you're running, there are some people who are running, they are serial runners.
Oh, they just run.
Like the people who just run.
They just run.
Every time.
They know they want
you're
to
just competing. Yani wewe.
Participating. That's not competing.
Uni participants. Like every election, watu wanajua. So and so lazima atakuwa. Like who utasindikiza watu, but people won't take you seriously. Because now you're not doing it also with the seriousness it deserves. But ukisema umetoka na unataka, you just go for it. So one, your time must be right. Two, and I feel at our place 2027, I don't think it will be an ideal time. Because you see hata for Kasongo 2027 atakuwa anatafuta second term. Sindio? So it's not a transition year. Transition year ndio at least inakuanga vitu everybody's aligning for new entrant. Kila mtu ana align. So resources zipangwe, uangalie opportunities, uangalie who can be the team that I can work with. There's a lot of things to consider. Upange kazi. Uingie kwanza grau, jipe 5 years grau. Bila hata kusema una run grau tu.
Uko tu yani.
Wewe uko tu bro. Matanga tu, health camp nini, na mimi na wasuka tu ma tournament.
Hata usemi.
Bro. Mimi naambia hata staki hizo story. Mimi mnasemanga nini, me just want to do my work and go. But now when time is right is when you declare want to run. By that time usha
hapo unaendanga unasema ni wananchi ndio wamesema.
Wameni propose.
Nimejaribu kukataa. Nimwambia mimi nataka tu kuwa daktari.
Wananisukuma wasema niache hii kitu. Niasema medicine nichukue, so I think it's something we should consider. Those who can they really should give it a try, because the more we get the numbers, the better we will improve the healthcare Kenya.
And I don't think you really have to win. You know, kuna hii mentality that we go into politics sometimes, you know, some people mimi my political manualism, sometimes you can run to just have that say. Ukona tu numbers tu hapo, unaweza convince mtu in a county ya wake somewhere I won't mention. The chief officer of health is nothing close to a medical officer. No, nothing close to yani a medic. They are totally in a kitu tofauti sana.
But yeye ndio chief
officer. So I'm like, is it that as people are not in that space, ama ni nini?
It's true, dog. It's true. Me, I've told you, our greatest undoing is sometimes you are not involved in things that matter. We are not at the table that makes decision.
And it's because of the profession.
Exactly. Wewe kama, you see, asajo nataamka asubuhi anafikiria list yake ikoje. Hata fikiria acha nitafute governor XY.
True.
Nisaidie tuongee na governor XY tuone tutapanga aje hii kazi.
True.
Na hiyo time.
Unajua sometimes hata governor wanataka tu wa sponsor, just sponsor the campaign.
Bro, nobody will ever give you something if you didn't do anything, if you did nothing for them. hiyo point ulikuwa unasema kama mtu anataka ku run for the sake of, you see you can run targeting something different.
Yes.
In that you're not running to win the election but you're targeting something. If I don't get this, then I'll have a position to get this. ABCD.
I'll be in the discussion
somewhere. Yes. So mtu atasema acha nitafutie jamaa ABCD. Hiyo pia ni sawa. Hiyo kama that is the goal, it's fine. If that is the goal, then that is fine. But you see, if you're running to win, I believe just give it your all. Enda huko mwisho bana. Enda huko because at the end of it, if a stock pay your all, huwezi hata bana. In this life, ukipanga tu kazi bro, imagine you have like 10 years. Mmekaa tu 10 years mmekaa. Mnaangalianga tu mtu vile anaenda huyu. Of course mmesoma opponent, mnajua weaknesses, mnajua strengths, you know where to attack, you know where not to mention this and this. Like umeshasoma the patterns za hii constituencies ikoje. What is the population, tunaongelea watu wagani, majority ni wagani, what do they do,
unajua
what can I do to intervene kwa watu wenye wako like there are a lot of things that ukiangalia tu vizuri critically you should be able to be somewhere.
True. Daktari, we wish you the best. Mimi najua you'll be on the ballot somewhere in the not so far future. And we wish you the best. And we need doctors in that parliament.
Yeah, it's true. We do.
We need medics, not just even nurses, even clinical. You should run.
Like we need people who are in this healthcare industry.
Yes, run
to
for
be at those discussion tables. Politics runs day-to-day activity. That is something I tell people every day. Saa hii vile tumekaa hapa doc, it's determined by politics.
True.
If we have political instability in the country, atungekuwa na hii discussion sahi.
Kama sahi what's happening in the Syrians and
exactly. Sahi Iran, Israel nani anakaa ati una discuss mko kwa podcast.
Exactly.
You will never have
because
that
there's
time.
No peace.
Yes. And that is politics.
Yeah.
So politics runs everything. That's why everywhere you go lazima unaambiwanga study the politics of the place, even
office politics.
Exactly.
I was just talking to my friend before you came and I was telling her she's a chef. I was telling her, hey, kitchen yako lazima ukuwe na kitchen politics. And you have to master it.
Yes, for you to survive
exactly.
In that kitchen.
Yeah.
So it's politics runs our life on our daily today activity. So
speaking of politics, unaonaje hii top set 2027?
Hey, hii top set bro itakuwa tricky. Kwa ngumu sana, sijui kama cousins wataweza.
Cousins itabidi waweze. Itabidi waweze.
Wacha nikaambia dog. Saa hii ingekuwa tu ati baba akufanywa kitu.
Mazi. Jamaa angekuwa baba kweli. Angekuwa, si ndio?
Angekuwa. Jinzi walikuwa na mtu last year.
But do you think Baba is going to hold this guy until the end?
Unaona msaki akienda kudrone hivi alafu ushikwe tu hivi na by the time kichwa ndio yani mapua maji yamefika hapa.
Ama ulikuwa ushakunywa
umetoa kidogo alafu mtu anaku. That's what Baba did to that guy. I think na hiyo kitu unajua Rigija amesema tu in the passing but it's the truth.
It is true. Baba saved him.
Alimsave, alikuwa that time agency wangemtoa.
He was gone. He was done for because he had no one. Alikuwa mansolo. Ukiangalia hata cabinet he had
come back open hivi yani ako
with no one else with national
exposed back to their own community.
But you know that's why sometimes I look at Baba and I say he does those things and he, we call him to betray. But think of it. Had this guy left office in that manner, would we have a country?
We wouldn't.
We wouldn't have a country.
We wouldn't. Wacha nikwambie first. Mimi, yes, watu make decisions za baba ni za baba, but I don't know why I tend to think huyo mzee huwa decisions zake huwa zinakaa ni kama as it makes sense.
But in the long run
ukiziangalia unaona okay
hapa
pia okay naona kenye umefanya yes as per us hujafanya right kitu leo hujafanya ni fit lakini umetusave kidogo kuna venye
because I think we would have gone into anarchy.
We would have gone into anarchy. Military ingechukua
sasa hivi tungekuwa tunatembea na maidi kwa
Burkina Faso style military.
So we are still thanking Baba.
Bro Joe, lakini unajua sasa shida ni si Wakenya ndio walikuwa wamepigia Kasongo.
True.
Si ndio?
Walimtaka.
Si Wakenya walimtaka. Why not give them those of their own medicine? No, just being a sadist kidogo, but
Yeah.
kama umesema Festo is better than me and then you given to Festo, you suffer under Festo bana.
Yeah.
Wewe mbona unalaumu tena Festo? Unanilaumu mimi na wewe mwenyewe ndio ulisema ni huyu.
Ulitaka huyu.
Exactly. So I think sometimes pia Kenya sisi wenyewe ndo we create a lot of problems for ourselves. Unajua tu vizuri Festo naye mambo yake ni tricky.
And then we call baba to save her.
Exactly. Festo mambo ni tricky lakini bado utasema hiyo siku so ni mzuri lakini siwezi mpea. Acha nipe tu Festo. Festo ni mbaya, najua ni mbaya. Lakini wacha nipe so mwenye najua ni mbaya kuliko mwenye sijui. Like usually. And then
Kenyan
after a year you are now crying.
I hope the Gen Zs and millennials this time we vote. This time we just go out there and vote
bro.
for the people
We must.
Atupendani. Because let me ask you of your opinion on someone. So vile sure leo ni politics kiasi. So your opinion on these young guys who came up, the Gen Zs or millennials. Yes, we raised them up, then we brought them down because of their decisions. What's your take,
bro? You see, there's one thing in our generation. I sometimes party. These things are not cast in stone. Yes, tunaelewa we are the majority. But even this majority, you need support. You need some guidance.
True.
Guidance in iko hapa. Right now in the country, you have 2 political factions. Unless sisi to form a third one, of which hatuna resources za kuform a political faction. Sisi yetu badeni ni ya ideology na age na ideas na technology.
Without resources.
We don't have resources. Umeona hizi empowerment zinaendelea sasa bro. Mimi sasa natamani waende empowerment badalaki bwana.
Empowerment za nini hizi?
Unajua empowerment za lazima milioni 10 zianguke 20 million.
Sasa hizo ni gani?
Gava sasa iko na empowerment bro.
For youth.
Ama for economic empowerment. Empowerment forums.
Who are they empowering?
Bro, kwani wewe unaishi country gani bwana? What has DP been doing all along?
Mambo ya money bags.
What has he been doing all along? Empowerment. President 3, yeye kama 2, speaker anaweka 1, Sudi mzee mzima anaweka zake 2 safi.
Za Timba Exo.
Yaani
empowerment.
Bro, wasiona wanatoa do. Pako najiuliza alafu uelewa pia Kenya pia iko Kenya pyramid yetu haikai fiti
in terms of population,
in terms of even pia wealth distribution. Haikai fiti. Pale top hapo yes ndio kako sharp lakini kako na wase wachache
sana.
Lakini base ni big lakini iko na wase wengi. So that means ule mwenye ako na sharp pale na ako na resources ako na likelihood ya kucontrol mtu wako hapa chini na resources. So that's why you see, that's where resources comes in. So kina Kasmuel, kina Morara, yes, they're fighting very good wars. But at the end of it all, pia wanakaa wanajiuliza, how will we make it really?
Without money.
How will you make it really?
You're competing without money.
Exactly. Assuming tu mtu ameleta DP for empowerment. Yani maybe ni current MP. Alafu waende huko wachange mitakaa 10. Unajua vile wamechafua hiyo constituency yako ndugu yangu.
Mbaya sana.
And then wewe yes, youth uko na idea, uko na maono, uko na nini.
Corruption free.
But unataka kuambia watu kila time tutatengeneza, tunatafuta. Wanaiba.
Vampire Diaries.
Sasa hata ukisema VD bro, utapiga VD lakini ground ikifika Mkenya anakuambia bana mtu amelala njaa. Yeye anataka kusikia VD ama anataka at least akule.
So you're saying their politics is not realistic.
Their politics
it's not reflecting what's on the ground.
The ideal politics. It's the ideal politics.
How it should be.
But it's at the wrong time. You get me? It's the politics that we need.
So unasema hatujafika ile point as a country where we can say tribalism aside, corruption, bribery, voter bribery aside.
In fact, me I'm just waiting for nataka tu my fellow youths wanishangaze in 2027.
We vote against tribal lines.
Yes. Like youth equate ni a factor on its own. Gen Z movement na millennials on its own is a faction. Like imagine someone is struggling to court this faction. anataka kutafuta na unajua sasa ile Gen Z ilikuwa amorphous pia haikuwa na mtu.
Unajua mimi I think that's the mistake we made or they made. Hiyo kusema we are leaderless.
Exactly, ilikuwa amorphous.
Yeah.
Ile you don't, whom do we handle?
Exactly.
Bro, there are structures for a reason bana. There are structures for a reason. Na uwezi anza ku create, yes, mnataka mkue movement, a free flowing movement. But in the end, bro, you need someone to direct. You need to get a central point of direction. It must be there. Like hata kama mnasema yes huu mtu nini, but let there be a central person. Mwenye at least akisema mnasema huyu ako na interest zetu. Even if it kama hata si mtu hajaelektiwa ni mtu tu nini, but we must have someone who is speaking for us.
We need someone. Step up daktari.
So that ndugu yangu.
You tell me now as we wind up on this national politics maneras. Because politics is important. I want you medics to get into politics.
It's true.
As we wind up, who is your najua ni mapema but nipe your ideal ticket, a reasonable one. Sema Kasmuel na Morara.
Like in terms of in 2027 winning, in 2027 these two factions definitely the other side kutakuwa tu na the incumbent
the incumbent and who asikue nani.
I don't think akingangana kubadilisha.
Sifuna alisema apatie baba,
itakuwa anarusha unless jamaa aseme tu basi mimi nitaforfeit mlima. Which I don't think he will do. Taforfeit mlima and then because ukisema bro ni nilots on nilots, you've taken akale and then now umechukua mjaka.
Governor Homa Bay
going to be tricky. Wanga mchapa kazi lakini
numbers zinakataa.
Hapo wanaweza kimbizwa bro.
But wako na baba
kitu wachana na yeye baba bana. Hata sisi tulikuwa watu wa baba lakini I don't think I'll vote where baba will be. Bro, I'm telling you, I'm not going to vote because baba is somewhere.
Good.
Mimi I've voted Raila my entire
for
life.
Raila. We vote for Raila.
Mimi I've voted for Raila. They three times that I've voted Raila. Baba all through.
Me too actually.
But now time imefika nilikuwa najiuliza nasema yes okay. Nimepigia Raila ni sawa. Hatujafanikiwa. But I don't think this time I'll vote for Raila.
But you know people say that in 2027.
I don't think so.
I don't think so. Last bullet.
But that's why nakwambia huko hiyo mlima hiyo mlima itakuwa na mambo.
Your people, do you think we have a new kingpin in Western politics?
Yeah, natembea bro, itasumbua bana. In fact, Luyaland kama mtu hata consider natembea seriously in their coalition, they'll have a big problem. That guy is not only controlling Trans Nzoia. He's trying to reinvent Wamalwa.
Very true.
He's reinventing Wamalwa kijana.
And I think he's
giving me Wamalwa vibes.
He's doing it properly.
Hata mi ukiniekea ma DVD hapo uniekea natembea bro. Ati papa wa Roma natembea.
These are those two guys. Sijawahi sikiza those two guys, but this guy started doing his rallies. I was like, okay, we have someone.
Solo rallies.
We have someone.
Solo bro.
Amejaza.
Anatafuta tu na kina Wajakoya ndio anakuja lakini hataki mtu mwingine. Solo rallies.
He can do it.
Hii juzi vile ameshikwa na EACC akaanzia tour yake.
Alianzia Luanda.
Uliona Luanda bro? Uliona Kakamega?
Mazi.
Does natembea rule Kakamega or Luanda?
He didn't.
Na hizo ni Vihiga, Kakamega, 2 counties. Akaingia Bungoma kwa Weta.
Akasimamisha mchi.
Akapiga akawaambia mwambie akikuja nilikuwa.
Ndio tumesema ni tawe.
Na akaenda kwake. So me personally I think natembea is someone to be considered for sure.
Him and Matiang'i, can they take on?
No, they can't.
They can't take on the incumbent Kasongo.
They can't. They can't, bro. Natembea Matiang'i ticket in 2027, I don't think so. The numbers they will, I don't think so. Who is the president now? Matiang'i. And then Natembea as the deputy. I don't think it's for 2027. Juu acha nitambie 2027 kitasumbua ma cousins. Ni of course I know Rigiji won't run as president.
He can't. He shouldn't. He shouldn't been anywhere near.
But of course ataapili za makesi zake na atakuwa na kesi yenye iko active nini. Unajua Kenya.
I know, but I hope he fails.
Ukisha nini unasikia kuna kesi inaendelea.
So alisema sijui
the bench inaendelea nini, so that in a drag all along you can vie and then, but I don't think he will be running, but he will be very instrumental when it comes to Mount Kenya politics. So hapo tu shida itakuja ni who will carry it, because now Kalonzo will feel seniority favors him, na pia age is not on inside. Do you know Kalonzo ikifika 2032 atakuwa na run kama Raila sasa vile alikuwa na run akiwa something, but
wait, he's 70 what now?
Zimeenda bro.
Kalonzo is 70.
Yeah, he should be. So Kalonzo pia ana liberty of time. So I think that is the greatest card ataleta kwa meza, ambie bana niko na Wakamba lakini time sina.
Mimi pia ni sina.
Mnipe tu time moja.
So ni shida ni achukue nani?
Shida ni atachukua nani, because maybe Kalonzo Matiang'i. Wajaribu wa Kalonzo Matiang'i, but now they were convinced Natembea to run for second term as governor, but in 2032 they changed tactic. Maybe. And then Wamunyoro akuwa as the kingmaker.
Without a post?
No, he will definitely will Skevla alisema this time round is not making a gentleman's agreement. He's making written agreements. Lazima tuandike how we are sharing this government.
It's going to be interesting. I think it's going to be interesting.
Yeah, most for the opposition. It's really going to be interesting.
Let's wait for those formations.
Yeah.
Coming back, still on politics, but coming back a little closer home. What do you think of the union? We're also having an election. Is it next year?
Yeah, but I think Dav just done good. He's done good.
They've tried.
The man has tried. Yeah, the man has tried. I think I'll give them a 7 of 10.
7 of 10.
They've done good. Because you see, you don't expect kila mtu atasema ati umefanya fiti no, but
they had a bit of falling out after the internship issue.
Yes. And that was the major departure point for the union actually.
Yeah,
it was there, like hiyo ndio ilikuwa kama moment ile kila mtu anaona hapa cause hapo ndio mvurugano ilikuja, members are dissatisfied au wenyewe pia wako
and I remember after that we had the soloist here, and he made a good appeal for their case. And that episode is still there, guys. Go watch it. It's very interesting. All right. So waendelee.
Kimaliza psycho relax, wengine waingie pia afanye kidogo.
Would you consider?
We have a lot of doctors why not, bro? Me, I'm told you we are in leadership. Yes. Leadership is something that it just intrinsic. You don't need to uongozi haifanyi nini, hailazimishi
yaja peke yake,
nakuja tu. If you are leader, you are leader.
So you would consider it?
Why not? Opportunity kikuja, but no, I don't think I'll be running for union politics. I don't think so. I don't think I can run for union politics.
Umeshinda?
No. It's beyond my reach for now.
It's beyond your reach for now. What are you focusing on? What are you up to?
I think sometimes pia unakaa unafikiria you want to do the things the conventional way, things how they used to be done. Because the more things change, the more they remain the same. So I'm thinking of going back to school.
The conventional medicine.
Stuff.
What do you want
to get my masters, I get something in leadership too. And then from there sa unaweza jiposition vizuri. You get my brother?
After umeka hii kitu kwa sure.
Karatasi kaa hapa. Iko. Bro, tukianza hii kitu tulisema aje. That they won. You know, you remember the late Dr. Agumba, surgeon. A very great man.
Very great man indeed.
May his soul rest in peace. You see, alituambia vijana, nyinyi watoto wangu. Medical school ni ndefu sana. There's only one thing and you should never do in this medical school. Never lose your admission number. Just do what you need to do. Wewe fanya kenye unataka kufanya, but never lose your admission number.
Always have it.
That means just complete your course. Even if you don't want to practice medicine,
maliza,
get the degree,
weka hapo,
weka kando,
do your thing.
Because festo alai mbele ya Mungu mimi acha siku aifikiria ati sasa nitamaliza medicine nianze ku practice medicine, so mi bana using medicine as a degree, degree ya kawaida tu. Maza degree weka hapo, fanya vitu zako.
What changed?
Life, bro. Life has twists and turns, my brother bana. Twists and turns.
Ulikuja ukapenda medicine? Hii uemo yani ilikuwa tamu sana ama?
Uemo. Kazi ya uemo ni ngumu. Kuna kazi ngumu kama uemo kweli.
Jack of all trades.
Bwana. Leo umerushwa huku. Homa, trauma, decay, nini. Yani you are dealing with everything at once.
Unajua heri mimi usema heri decay na homa na trauma kuliko homa. Unasikianga because you daktari, I remember you in med school ulikuanga msee content. You used to like the hard things. But now you get here and
now you're treating your
complaints are just
it's the same
and they're
thing.
Repetitive. How does that?
Unakuwa tu ni
how does that
upper respiratory tract specialist?
Me ujita homologist.
You see my brother, kazi ya wemo nayo, as you know, it depends. Kama ukifanya kazi ya outpatient center watakurushia hizo mahoma nini.
Depends where you go.
Depends where you work. Because kuna wale tu pia wanafanya ward work, like it's different work depending una wako wapi. But honestly I don't think hii kada ya wemo ilifaa kukua for long. I think it was supposed to be a transition.
True.
Like ingekuwa kama kitu kama kungekuwa na policy like a year, we just maliza internship and ufanye more for a year as you figure out. Kama uko figure out during internship. Go figure out for a year what do you want to do.
I think I talked to a doctor who told me that it was like that for some time. They used it was 2 years.
Bro, it should be because unajua first tumepiga nje miaka 5 unajua.
Naze.
Unajua 5 years zimepita.
Kimchezo.
Assuming tungekuwa tulirudi shule after internship nini, sasa ungekuwa ni weni
consultant.
We will be discussing subspecialty. But sasa we are discussing.
I had Dr. Kamudi. Dr. Kamudi he has a very interesting story, by the guys go check it out. He's a plastic surgeon and he went immediately after.
Yes. After internship akaingia.
Yeah. The guy is 31.
Exactly.
The plastic surgeon.
That is the ideal now. That's the ideal medicine. Nashana hii yetu bro, hii yetu sasa najua hii yetu ni hii yetu, lakini hii yetu sasa poor man's medicine what, because now sometimes also unatoka internship bro, hujapata job, umetamak miaka kama 2 hauna kitu, lock up ya kusurvive nini ya BCD, toka hapo upate job, maybe Mungu akubariki upate ka county. Ukishaingia kwa county ndugu yangu ndio akurelease uende shule, unataka ufanye miaka ngapi? The minimum 3?
Yeah, 3 years ndio akurelease.
The minimum.
Na ushapiga zako mbili.
Ushapiga zako huko. Hizo zenye ulipiga hizo zililiwa na nzige. They're not being counted. They're counting that they had you.
And you know, hata kwa county maybe hata wamekuweka maternity.
Exactly.
You want to become a physician.
You want to become a physician.
That experience doesn't count.
Hata whatever you're doing ni kitu hata haudai.
Na I count for your experience.
Hii nayo hii ndio kitu siwezi do. Acha kuna ile rotation ulikuwa unatoka kusema
hii siwezi.
Liwalo hii sifanyi.
Which one was that for you?
No, I can't do peds bro.
Me too.
I don't think so.
Yeah, true.
Those small humans are difficult.
So you're going back, what do you want to do? Daktari ya wanawake wewe.
Kabisa, unajua tu tangu kitambo. Mimi sijai ficha tangu kitambo nikiwa shule. Do used to do this. You remember?
Yeah, how far your fingers are.
You.
Muruka used to tell us, you know. The farther you go, the farther you look. Yeah.
No, it's an interesting one. It's an interesting one because
it is. And speaking of that, there was a discussion I saw juicy, and this is on our Ever Toxic X. about people saying, okay, so this was a patient who was complaining that she went to a gynecologist and the gynecologist diagnosed her with PCOS without doing any test. I don't know what test she wanted. Without doing any test, just listening and deciding, you have PCOS. And her conclusion was, men should not be the gynecologists.
Why?
Because she feels in her mistaken, misjudged way that men do not understand the issues of women.
Actually, we do better. I think we do. We understand the issues better.
And it didn't make sense to me, and I was like, okay.
But you see, I think reproductive health medicine, it's both gender can do. Sidhani kama gender matters. It doesn't matter.
I mean,
if someone has a passion to do reproductive health, let them do.
Yeah.
Because your anatomy ni moja. Anyway, anasoma, it doesn't mean if you
have it,
that you understand it. Exactly.
True.
That is a very, very wrong assertion. Because it's mwenye ako na passion, I find aipige. Because bro, ukishaipiga, God willing, I'm not planning even to do it for a long time. Kimaliza
kwange tunayo hapo.
Ni
uingie
kando. But you see, where medicine is going, I think something oncology makes sense. Where the country is going.
Gynecology,
yes.
It's a big thing.
Yes. Remember our time, it was only Dr. Ganda.
Yeah.
Dr. Ganda only.
Yeah. Sasa wameongezeka kidogo.
Wako, you remember kina Eliazaro? You know Eliazaro?
Yeah, I remember him.
Yeah, he went in and I think he went straight. He went to MTRH, finished his master's and then went straight to gynecologist.
Fellowship.
Yes.
Amazing.
So people they're subspecializing pretty much early, which is a good thing. Very good thing, because those guys bana, mimi na work na Bazu hapa KU mmoja mwenye ni mdeadly sana, gynecologist mdeadly sana. He's among the pioneers of gynecologist.
Anaitwa nani tumuite kwa podcast?
Utatafuta Biggie.
Biggie akuje.
Tafuta Dr. Yengo.
The bigger the better.
Tafuta Biggie akuje.
Tafuta.
A very sound guy.
So what are you doing now, Doctor?
Very sound guy.
As you wait for gynecologist.
No, saisi tunatibu tu whatever that comes.
Have you tried entrepreneurship in medicine?
Yeah. Hey bro bana. Festo unanijua. Mimi najaribu kila kitu. Anything that I feel can. Yes, anything I feel that can work, mimi najaribu. Yeah, of course.
How is it?
Tumejaribu.
Iko pesa kwa medicine, doctor?
Been in business for how many? This is the third year.
Oh, you have a practice running?
Yes. This is 2.5. So tunapiga tu.
So uko na clinic ya kama
yes.
Level what?
We clinic ni clinic.
Level
utaka ikue.
SHA accredited. Unajua mnaandika SHA accredited.
Na SHA sasa you see. Where does SHA come in when it comes to outpatient and inpatient? Who do you think benefits more from SHA?
Maybe people doing surgeries.
Well, umeangalia, have you looked at the pattern of patients what wanna benefit from SHA?
Like
maybe
patients.
Yes, patient, like which type of patient categories that benefit, because maybe from what I've observed that there are categories that really benefit from SHA.
People need surgeries, I think.
Yes, like our surgeries, patients under a chronic disease follow-up, like what was CKD on dialysis, patients who are maybe cancer patients, oncology patients on chemotherapy, radiotherapy. You see, for
but
those ones,
patients, no. Tricky.
Bro, patient utapewa nini?
Consultation fee.
Wachana na hiyo. Achana na hiyo. Hiyo sasa tutawaona upenda yako alafu usiwahi lipwa forever. Hiyo kitu ni ya mkulima mkubwa bro. It's not for you. It's not for you. You are the startup who is just struggling kusimama
So where is your startup to tume wagonjwa
kuja hapo Roysambu Gold River.
Unatibu wanaijo?
Wakuja
Nigerians wanakuja hapo na wame overdose. Forgive me. I'm just joking.
This guy is joking. Yeah, he's not serious.
So Roysambu, what's the name?
Gold River. Health.
How is it? How is it being a business owner in medicine?
No,
I mean, it's probably a whole topic on its own.
Yeah,
but in a
it's true.
nutshell.
Entrepreneurship, it's called commercialization. You want to commercialize your skills. how else can you as a medical doctor is for you that you're running your own facility. Tumeungana na Festo, tumefungua cancer center, tumefungua, tumeweka kimashini kietu kia x-ray, tunafanya kilab pale, so it's just business like any other. But now at least you're opening it with something, you have some knowledge on what to do, which test, kama patient amekam, like unajua how this business runs. Wewe mtu hawezi kudanganya bro ati mtu uko na employee hapa anakuambia stories di patient alikuwa huko zile unamaanisha aje wewe?
What do you
niambie
vizuri. What are you saying?
Mbona sikupati fit? Unanipanga nini? So it's challenging bro, it's challenging, like I think like any other business. Kenya nayo kupiga biz bro, unataka you need thick skin. Is the business
paying for itself?
Yeah, for now, we broke even. We broke even after a year, I think so.
I think if you don't close before you before you break even, you're good to go.
Yeah, we broke even, so it's saisi sina hata mimi sinanga mambo mingi ya kufanya huko.
Mambo inakimbia.
Ndugu yangu tu mdogo huko. Mimi naendelea kuhustle like always.
Vile inafaa
bro. Nairobi nilikwambia, what we say Nairobi bro, tumetoka far bana. We've come from far.
From Budalangi
to Nairobi. How many?
By the squeeze is kiangi floods huko Budalangi.
Hizo bro. Hizo sai watu wanaishi like floods inatesa watu huko kwingine, tulidonatea watu wengine pia wataseki kidogo. Raisi tuna because if the kilometers that you're covering to come to Nairobi,
huwezi kuja ku relax.
Ukikuja kulala sio nirudi lale home bana. Just go sleep at home. Why are you sleeping in Nairobi?
Nairobi hakuna usingizi.
Why are you sleeping in
Shamba
Nairobi? Nyumba inalala ndani yenyewe unalipa. Sasa mbona umelala hapo wewe?
True that.
Nyumba si yako, why are you sleeping in there? Mwenye amejenga utamlipa. Utamlipa nani? So amazing. I think there's just an intrinsic motivation that comes when you know you have to make it. Whether you like it or not, there's no two way about it. You need to make it. Because once we left home for Nairobi, what else?
Umekuja kutafuta.
So kama shughuli najipa sijui wapi, mimi hata muniite wapi Kapengula nakuja. Sikosi.
Amazing.
So long as inafuata, there's something you'll get. So you do. You are.
So daktari, tumepiga hapa more than an hour. Sasa ukimbia kwa hii podcast.
Wana imesha.
Kitambo. Isha story ndio imekatika. Naona producer pale ananiambia masaa ndio ile.
Haina pressure bro.
But as always Daktari Akwikwan is here, voice for doctors. Wewe tuko na story mingi. Hii hata kama na cut short.
It's true.
We still have a lot. Ini kionjo, first of many.
Sira inafaa tukue na section ya kudiscuss. Let's discuss Maseno University School of Medicine. Peke. Tuambie tu watu how med school is in Maseno. Which I think it's should be the best medical school in the country.
By all means.
Should be.
By all means.
It should be.
By all means. Bado sijapata mtu anasema otherwise, so
it should be the best. It should be the best, my brother. Because unajua tulikuwa tunaambia kitu kama tuko shule we like mwalimu anatuambia nini mnajisifia nyinyi mgema.
Tulikuwa kwenda UN. You remember you said you wanted to go UN? Me too.
My whole life bro was pegged here. Me I was like kama kuna university sinia Nairobi kuna konga na nyingine kweli the But kumbe where we ended up really shaped our life. They gave us a very good foundation actually.
In everything.
Very good foundation.
And we thank them.
We really do. Yeah. If Propaganda watches this, big up man.
Yeah, and we're bringing some of the lecturers.
Bring them.
Because we have a Kisumu brand. Some of them are coming very soon. Wanakuja, wanasija.
Bita anakaa Manyamuhanga anakaa.
Ushasema.
You know that guy went he did surgical oncology?
No, he's a breast surgeon.
No, the breast surgeon now that's under surgical oncologist, you know. Surgical oncology, there are very few.
He's one of the few.
Bro, there are a lot of things to be. Actually, when it comes to careers and the good thing with working with a lot of people is you get their perspectives.
Yeah.
Unapata perspective ya breast surgeon, gynecologist, a clinical oncologist, a medical oncologist. Yani unaweza ona okay. So trends, you can be able to trend kuona uta end up wapi.
True. Yeah, and that's as you said at some point, it's the importance of this emoship. Emo phase. You get to actually, because I know we say it's good you go after internship, but you might end up in a place and you're like later ningeenda huko sikuona ile sikujua about this. So this phase,
basi sasa kama ni hivyo doc then inafaa ikue ukitoka emo ukisema mimi nitafanya gyne then go to gyne department straight. Work in gyne for those if it's 1 or 2 years. Work in gyne purely. And then see if it's still your thing, go.
If it's not,
juu
because you know
kitu unazungushwa mwaka gyne, mwaka surge, mwaka mat, mwaka
isaidi.
By the time umezunguka ni kama umerudi internship, unarudia tena rotation, ni kama uko na logbook.
Anyway, we need those policies to change, and we are the people to change them, and we need to be in those spaces.
It's true.
So this was the political edition of Daktari Akikwan. Niliwaambia tuko na range. Kama kuna kitu iko hapa ni range. And Dr. Boni is vile mnaona politician. Amejiseti vile yako hivyo. And he's a doctor, a brilliant one for that matter. And an entrepreneur and all that. He's one in many. And Doc, thanks for coming.
Thank you, Doc, for having me. Really appreciate it.
Karibu sana.
Tutapiga stories zingine.
This is the first of many with Dr. Oduory. Yes. Boniface. Mtafute huko umesema inaitwa gas gold mine,
gold river.
Si gold mine,
ataku mine gold.
Nifikiri unachimba dhahabu huko.
Mto wa dhahabu.
What inspired the name?
You see, initially Yesu alikuwa anaponya watu wapi? Kwa anapeleka kwa mto.
Yes.
Ulikuwa ukibatizo unafanywa nini?
River Jordan.
Ukibatizo what happens?
Naiko kwa maji,
You're born again.
Hallelujah.
You're healed. You're okay.
It's deep,
It's deep. So this is a river, but now sisi tuna heal through medicine. You get
ile inafaa.
Maji matakatifu.
Amen. Kwa hayo mengi. On that note, Daktari Akikwan, it's adios from us. See you next time.
Thank you.